we're joined by Saffron Corduroy, who's Deputy Chief Executive of NHS Providers, which represents hospitals and other NHS trusts. Rushanara Ali is Labour MP for Bethnal Green and Bow, and Councillor Kay Cutts is leader of Nottinghamshire County Council. Welcome to you all. Saffron Corduroy, if I can start with you. You've heard what the Chief Scientists have said this evening, and you've seen, I presume, the notes from SAGE. Give us a sense of what it's like in hospitals now. With the infection rate rising, what are you actually seeing on the ground there?
So what we are seeing on the ground is hospital chief executives telling us how concerned they are about the rising rates of infection, the rising admissions that they're seeing across their hospitals, and also the increased levels of occupancy in ICU units in particular. So we really are seeing this ramping up. And as your report has said, you know, we are back at the March level. So there is real concern out there. And we are clear that we really do need to move to some tougher lockdown measures if we're going to turn off the tap of infections and support the NHS through this winter.
When you say support the NHS, do you worry that hospitals will be overwhelmed?
I think the real issue to focus on here is that we need to get through this winter by treating COVID patients and also treating people with other conditions. We need to continue to carry out routine operations, diagnostics. We need to make sure that our accident and emergency departments are fully functioning. So that's a really big focus. It's not just about managing COVID, it's about managing this in the round. And winter, as you know, as we all know, is incredibly pressurised in hospitals and across other services. This is about ambulance trusts, mental health trusts, community services as well.
Councillor Cutts, from where you're standing with Nottinghamshire, it was interesting, wasn't it, that no sooner had the PM introduced those new 3 tiers that we heard the real opinions of the Chief Medical Officer saying he's not confident that even Tier 3 will get to where we need to be to stop those admissions being overwhelmed. Your thoughts?
Well, in Nottinghamshire, we have the virus rate somewhere between 90 and 290 across the county, about 900 in the city. And therefore, I think the level 2 is absolutely the right level for us. I held a meeting last week with my colleagues, that's the leaders of the district councils and the leader of the city council. We talked this matter over. And we decided we wanted to all stay together. So level 2, I think, is suiting Nottingham City and Nottinghamshire because we all agree with that. Yeah. And I honestly think we're going to this way get on top of the virus because, of course, level 2 actually means that there's no mixing in households, and that will be strictly adhered to. It also means that the pubs and the clubs and the bars will close, the hospitality, at 10 o'clock, which I think is a good idea. But it further means that people can still meet in groups of 6 outside. So there is that possibility to keep socialising on a very, very limited level.
I can understand.
Certainly not indoors mixing.
Sorry, I can understand why, of course, you'd want to keep the whole area together. But when you break it down, Nottingham itself has got 834 cases per 100,000. I mean, that's higher than Liverpool, which is in the top tier. So I wonder how realistic it is to do that, to pretend that it's the same for Nottingham as it is for Nottinghamshire, when you can see that disparity and you must be worried that the city itself will be overwhelmed.
I'm not pretending about anything. We've talked to each other and come to sensible conclusions. Surely we leaders on the ground know a little bit more than just some sort of blanket assumption. And we decided between ourselves, and that includes the leader of the City Council, we would rather be together because policing it otherwise would be very, very difficult. And I know we have the support of the Chief Constable, Craig Guilford, in this. He's actually leader of the Local Resilience Forum, and his opinion is to try and police it differently would make his job extremely difficult. And a lot of the virus is among students who will be on campus. So if they've tested and traced them, they know where they are, and they are being very sensible and staying on the campus. So we're hoping to get on it that way. But really, you have to consider the whole economy. The Prime Minister is walking a very, very delicate line here between keeping the economy thriving and keeping people safe. And that is a difficult thing to do in these circumstances. I support him.
Let me bring in Rushanara Ali. From where you're sitting, your own leader seemed less convinced that these measures were working. Keir Starmer seemed to have changed his approach today and said, actually, I'm sceptical about whether these are working now. Do you believe that, particularly in Tower Hamlets, which is one of the worst hit areas, these measures are enough for you?
Well, look, we've always wanted to see the government take action so that they can get a grip on this virus and also make sure that the economy is able to resume. And what's happened is that the time that has been gained from the first lockdown and the pandemic beginning, a lot of time has been lost in terms of not getting testing and tracing right. The government set up a very centralised national programme, not involving local organisations, local authorities. We begged the government to allow local authorities to work with local health partners to provide testing and tracing on the ground, because the tracing element can be done better at a local level. The government has failed to listen, and it's made it very difficult for local authorities to act in a way that can work in sync with trying to bring control over this virus. So what we need is the government to get a grip. What we've had over the summer is stop-start, a yo-yo approach to telling people to go out to work, then telling people to work from home.
And what would you
we need
want
some
now?
Clarity.
What would you want now?
Well, we need an economic package to go hand in hand with the kinds of restrictions that local areas are facing. In cities like London, we do need much more clarity about how to take preventative action. The infection rates have been rising. The testing
Would you
hasn't...
prefer to be going up to high alert now, to the top number 3?
No, I'm not saying that. But what I am saying, in a local authority like ours, area like
Very
ours,
high, isn't it?
It's in the top 10 in terms of infection rates in London. Our mayor, has advised residents to stay apart between households, because we think it's really important to encourage people to voluntarily do all they can to minimise the spread. But we need the government to act, and that requires both clarity of messaging, but also a clear economic plan to make sure that businesses and families are protected as lockdown arises.
Stefan Cordery, let me bring you in, because Rushanara's talked about test and trace, and that's a point that Sage was making as well. Delays, poor rates of adherence have all played into where we are. Do you accept that has failed as a system for the NHS?
So we have consistently, as an organisation, on behalf of NHS trusts up and down the country, said that the government has had a stop-start approach to test and trace, and we needed to have got going with this much, much earlier and much more quickly. I think that an effective test and trace system was always one of the key elements that was going to get us into a more manageable place with coronavirus in the absence of a vaccine. So I completely agree that we need to make real progress on test and trace, and I think that some things have been done with test and trace to get it up and running as quickly as it has been.
Stefan, I'll be honest, your line's breaking up. We'll come back to you as soon as we get that sorted. Councillor Cutts, do you accept that has been a major failing on behalf of the government not to be able to sort that out?
Well, that's not quite the whole picture. We have had some responsibility for where the testing and tracing units go. What we don't have responsibility for is the results and how they are processed. And I would like to see there be more local processing, so we can absolutely get the information very, very quickly. So I agree with you on that. But we have had responsibility for where these units are going to go. And only today I was informed that we were thinking of doing it in one of the towns tomorrow. And then I suggested somewhere else it should go, I think, towards the end of the week, because we do need to know where the virus is, and we do need to know how to control it. We have had control of these units for some little time now.
You did say at the beginning that it's a very fine line that the government's walking, and certainly within his own party, I think it was Charles Walker this afternoon, but there have been others. He said the Conservative government was trying to abolish death. His point being that actually at some stage we had to accept that people in their 80s and 90s would die, and that not every single life could be saved because it was hurting younger people's life chances and prospects. Do you accept where he's coming from? Do you agree with that?
Well, I do think we need to protect our older citizens, and if we can protect our older citizens by being sensible and carrying out sensible precautions, I think we should do that. We shouldn't be condemning anyone to death. People do die, of course they die. They die every year. They die from flu every year. But nonetheless, there is a responsibility between the generations to look after each other. I know the young people have responded to this and they are very careful. They don't want to lose their grandparents or great-grandparents, and that's why they have been prepared to behave themselves quite sensibly.
Saffron, you're back with us. Do you agree with that? I mean, do you think that, this is what the NHS has to deal with the whole time? Who are you going to treat? Are you going to treat cancer patients? Are you going to treat young people with heart problems? Are you going to just try and save the lives of those who are in their 80s and 90s? I wonder if you accept that maybe the balance has gone too far.
No, I don't accept that. I think that we are in a situation, which is what we have said, that, for hospitals to deal with what's directly in front of them, they need to see a tougher down so we can turn off the tap of infections. Because if we're going to run a service through this winter, which can deal with both COVID patients and also those who need other types of treatment, routine treatments, cancer treatments, diagnostic treatments, then that's what we need to do. We need to stem the flow of admissions for COVID into hospitals. So it's absolutely the case that if we have an effective control of how infections are transmitted, then we can make sure that the NHS can be supported through this winter. Remember, the winter is a really, truly busy time, and we've got a workforce that is incredibly tired and burnt out.
And overworked from this past year. Absolutely, yeah. I think we could all agree with that. Rushanara, let me just ask you, in terms of, I mean, you've explained you want more, obviously, you want more support for track and trace and you want more financial support, but we are where we are in terms of what you're getting now from the government. Would you push to get Tower Hamlets or to get your London Borough into a different place in terms of preventative measures? They can do that if they're tier 3. You can impose more local restrictions. Is that
look, the government, that's not the point. The point is that the point is we are not going to be able to tackle this virus without dealing with the systemic issues. This government has not had a strategy in getting a grip on this virus, and that is why we're seeing deaths increasing. They haven't learnt the lessons from what happened in the first lockdown, and what we need to see is the government getting a grip on the infection, as the health professionals are saying. And what we've seen over the last few months is this strategy. There's been one strategy, which is to blame everybody else, blame public servants, blame other institutions, but not take any responsibility for the spread. And that's what needs to happen.
Thank you all very much indeed. Thanks for joining us this evening. As today's measures were announced, many parts of the country were still coming to terms with the economic after effects when rules were tightened back in the summer. Newsnight's been following the stories of people in Bolton in Greater Manchester. In July, with cases of coronavirus rising, the town was placed under further lockdown restrictions. So how are people getting by? Filmmaker Nick Blakemore has been back to Bolton to find out.
It's just been horrendous, really. You're getting mixed messages all the time.
It's getting difficult again. So I don't know what to expect because it's not on our hands.
We're all lost for words to explain what is different about Bolton. Why are we being crucified?
How's the free rolling?
If this local lockdown carries